Hari Om Dhanvantari. Namami Dhanvantarim Adidevam Surasurai Vanditapada Padmam Loke Jaravrutvayavrutunasham Dadaramisham Vidaushadinam. Now we'll start with our Rutucharya. This is a chart what we can see into it. Ritu is season and Charya to be carried out. Rutucharya holds great significance again in our Ayurveda. As per the principle Loka Purusha Samyavada, the interrelation of individual and nature influences the individual's health. Variation in the environment either absorbs energy or promote the same. As a result, dosha, dhatu and mala will be altered. Ancient sages of India have programmed the whole year into 6 seasons after deep understanding of the nature-wise. According to this, the year is divided into 2 distinct skalas. Adana Kala is also called as Uttarayana, northern solstice. The word is derived from Adana, taking away. During Adana Kala, the sun starts traveling in northward direction. Adana Kala is composed of 3 seasons: Shishira, late winter, spring, Vasanta, and summer, Grishma. The sun and wind becomes increasingly powerful during this period. The sun takes away the strength of the people and cooling qualities of the earth. Increasing heat reduces energy of individuals. During this period, plants should predominantly bitter and astringent and pungent taste. So that is Adana Kala. Visarga Kala is called Dakshinayana or southern solstice. This word is derived from Visarga, meaning giving. The Visarga Kala people typically gain strength. Visarga Kala is composed of 3 seasons. Rainy season, that is Varsha, autumn and Sharat, and Hemant is winter. So purpose of Rutucharya, if we check into, Ayurveda has laid down certain do's and don'ts during every season in order to keep health in spite of the seasonal influences. A good seasonal routine helps in achieving balance of doshas. Okay, so we come with the Hemanta and Shishira. Hemanta, that is Margashira and Pushya, that is mid-November to mid-January. Whereas Shishira is Magha and Palguna, mid-Jan to mid-March. Both have same qualities, that's why I have put together Ritu Lakshanas. It's a cold, and Divi. Divi means wet with dew. That type of a season it is. Here, Agni, digestive activity, becomes more powerful. Increased Vata gets obstructed from spreading out due to cold atmosphere outside, which can digest the tissues. It starts digesting our own tissues here, where more intake of sweet, sour, and salt helps reducing the Vata. Because this is Vata Hara we have to do here. So that is done. The strength of a person remains the highest grade during this period. The nights during this periods are longer. Ahara wise, we can example wise, wine prepared from jaggery they were using earlier can be taken. Wheat, gram flour means heavy food. Sweet, sour, and salt. What is giving? Milk products, sugarcane products, corn, edible oils can be taken as a part of food. Here, he advised massage, udvartana, exercises, clothing leather, silk, and wool, keeping yourself warm. because it is somewhere in the month of November, January, and slowly we are coming up to the March. So good exposure to sunlight and fire to keep warm, he says. Here, earlier to this, there will be Pitta dosha would have been vitiated. To specify, we are doing all these aspects. We can check into it. So this is what we can see here in this doshas wise. Same thing we can see because it's after November, December, January. See, 2 months, November to December, December to January. 2 months are taken as a one of this Rutus wise in ours. Then comes Vasanta. That's a spring season. That is somewhere from the mid-March to mid-May. Here, strength of a person in this period remains average. It's not too strong or not too weak. He can manage in between. There's a vitiation of Kapha dosha. Agni fire is coming low here. Because obstruction parts was happening, that is coming low here slowly. Person should consider taking in easily digestible foods because digestion fire is low, he can't eat a guru food here. Predominant tastes here include tikta, that is bitter, kashaya dravyas. Tikta is bitter, kashaya is astringent, and katu, pungent. Means here these all are vata, hara, because vata was increasing earlier. So that has to be reduced. Otherwise, we will go into vata doshas. And to specify that also, he gives Shita, Snigdha, Guru, Amla, Madura are not preferred here. They will cause you again, Pitta Vruddhi will happen. Vata also increases. They will be because fire is not good here. Fire, when it is not good, first of all, fire is not there. You are putting cold means fire goes down. Snigdha, you cannot digest. If it is oily content or heavy thing, it doesn't happen. Guru, that also same thing causes for us. Amla, Madura, fire is not there to Madura, it cannot digest sweet at all. So it is not preferred here. During this period, one should always have a warm water bath. March and May, not too hot or not too cold. That also helps in the digestion of our food. External application of chandana to making him cooler. Powder, kesara powder, agaru powder is also advised before bath to make your system cooler. Among Panchakarma, Vamana we give here because Agnis are low and all are up to the lower level, upper level. Therapeutic MSS what we call. Nasya and the nasal medicines are advised regularly. But here you should avoid sleeping daytime completely. Agni is not at all good. So if you sleep and do nothing, no activity, nothing, it can go down. If you keep at least activity, that level of the Agni will be in a better state. So in Vasanta and Chaitra Vaishaka, it comes in Chaitra and Vaishaka Masa is known as Vasanta. So spring season. This has to be considered here naturally. Then comes Grishma. This is summer. Summer is known in the month of Jeshta and Ashada, month of May and July, what we say here. The increased heat. In this season decreases the strength of a person. Agni of the person during this period remains in a mild state. Sun rays become powerful. Kapha decreases. Vata increases day by day. The predominant rasa is Katu. Kapha dosha is easily pacified during this season. Foods that are lagu to digest are most recommended. The properties of food to be had in the seasons are Madura, Snigdha, unctuous, Shita and Drava, liquid foods like rice, lentil, etc. can had during this time. Drink plenty of water, buttermilk, etc. in this season. Milk intake is ideal during this season. Exercise, sexual indulgence intake Vulva should be totally avoided, he says, because energy is not there. External application of sandal paste is ideal to cooling of the day. Wear light dresses because it's too hot sun. You cannot wear a warm clothes. These are the qualities such as being given very easily and simple form. Varsha comes in Shravana and Bhadrapada, mid-July to September. Rainy. Agni during this period is highly weak. The predominant rasa here is Amla. During this period of Vata dosha gets vitiated and Pitta dosha is also known to increase during this season. Because Amla is there, that's the reason. External application of oil is advised during this period. Bath should always be in hot water. Panchakarma procedures like basti, medicated enema, is indicated during this season to elevate the vitiated Vata doshas. Basti is a best remedy for Varvas dosha. Sleeping during daytime, sexual indulgence, exposure to cold, rain and wind are contraindicated during this season. Udvartana with Chandana, reverse way of massage, the dry massage, bath with warm water, pearls give soothing effect from the aggravated pitta, he says. Then comes Sharat Rutu, Ashwini and Kartika, mid-September and mid-November, autumn. The predominant rasa is Lavana. The person's strength remains medium. Vata pacification takes place during this period. Aggravation of Pitta may also happen. Food that pacify Pitta should be taken. Food should be taken only when we are very hungry. Panchakarma procedures like Virechana, that is for Pitta, Virechana is the best medication. And Rakta Mokshana, excess blood vitiation, everything is concerned with the Pitta. Letting with the Jaluka or with the needling part are advised during this season. Exposure to moonlight is also advised because Pitta is more here. External application of sandalwood paste is good during this period. These are the regimens to be followed as much as possible, what we say, for our own conditions, for our own good qualities to have and maintain in the health aspects. Here we covered rasa, what is necessary to be taken, what all to be followed in our lifestyle. Otherwise, what will be the causes of conditions also we have taken. So that is Rutucharya. Then comes Sadvata. Whatever we say is to be followed. What is good, what is not good, how to be done, what to be done, who to do, who not to do. Conduct has to be taken. Attitude changes, what we can call. This is very much detailed and depth-wise explained in our Ayurveda. It's the only science which deals with the intrapersonal or interpersonal relationship to be one of the component of health. Code of conduct is specific to the role played by the individual. Apart from this, the psychic and the individual is influenced by the people, environment surrounding him, which can cause emotional disturbances. If I am seeing regularly fightings or whenever the bad type of screaming or killing each other or throbbing or something or hurting someone, my emotional also gets affected. My psychological effects also affected. Surrounding things also happens. The same may be the case of the individual behavior, which can influence others also. If I am not having a good food or all stale food, my system is with tamoguna, not digested completely. I am in a very bad mood state. My mind is in a very bad state. You can see the changes there. But your harmonious environment is not seen. In order to achieve harmonious environment in the society, one has to follow certain code of conduct. Ardra Santanaha, caring and loving other beings has to be done. Others also are with kith and kin, whether I know them or not. That has to be taken care. Tyaga, sacrificing, has to be taken care. When necessary, we have to take care of that. Otherwise, we are not, if I am too selfish, is going to be a vain for as a known to be as a human being. So some conditions wise, whether you like it or not, for the good purpose concerns, we have to be tyagi. Kaya vak chetas madamaha, having control over kaya body. I should know to control my body language. It shouldn't get irritated or cause any vitiation or cause any sexual arousing to the person. This has to be taken care. Kaya walk. Walk speech. Walk is speech. We know you shouldn't get hurt anyone. You should not affect anyone's psychological or mood aspects to become violent for them or go for depressions. Chetas, mind. So also to not hurt anybody. I don't have any rights to hurt anyone. Swartha buddhi, parateshuhu, being considerate with others' belongings, not destroying. If it is not my things, let me spoil it or let it get spoiled. If my mobile is fallen outside somewhere, I just throw it out outside or I stamp it out. No, these things has to be not. Take out the mobile, ask who is it, and hand it over to him. Otherwise, now though we have police people, we can hand over to him. Na pidete indriyani, not to exert indriyas too much, watching too much of TV or mobile activities. That's ati. Ati is not good. Hina also is not good. Ati also is not good. If I am not using when is necessary any my objects or gadgets or something, when I have to call up something or read something, I should necessarily use my computers or my mobile. That shouldn't become addicted. I shouldn't use it too much of that, which will harm my system, harm my indriyas, where it can cause you permanent damage or loss of percentage. Na chetaniyati lolayate, not to indulge in indriyarthas in excess. Like as I mentioned just now, this also has to be not done to harm ourselves. Because our indriyas, if they get affected, we are losing them permanently. We are not supposed to use it in excesses. Swasthya Rakshana Sutra, principles of being healthy. This is what is necessary. Individual adhering to the following code of conduct regimens shall be devoid of diseases. Nityam hitahara vihara sevi, one who indulges in congenial food and activities. Samikshayadgari, being discriminative. Vishashayus asakta, not being slave of sensory cravings. Dataha, who is ready to give charity. Samaha, not discriminating among fellow members. Satyaparaha, truthful. Shamavan, forgiving nature. Aptopesi, serving the aptaha, friends, teachers, elders. Unethical conduct, according to Ayurvedic Satvrata, indulgence includes himsha, causing injury or torture, asteya, stealing, robbing, burglary, injuring a person, to steal, etc. Anyat kamaha, unlawful sex activity, payushan, abusive, harsh speech, anartha vachanaha, parushaha anyatama, scolding, speaking lie, sat vinalapam, speech causing dissension, separation, breaking of company, vyapada, quarrel, intention of harming, abhida, jealousy, not tolerating good of others, viparya, finding fault, misunderstanding, faithlessness, scriptures, elders, etc. Ayurveda classifies developing sadvrita qualities into 5 categories in this manner. Ethical conduct, developing an overall self-control and behavior. Social conduct, having the good behavior and moral practice in society. Mental conduct, interrogate about yourself, ask questions about the purpose of life, why do you live, who you are, connect yourselves with the divinity and eternal nature of the soul. Moral conduct, be responsible for good deeds that can protect the self and masses. Physical conduct, good hygienic practices, maintenance of good health and proper, etc. clothing. All this, the conducts exactly comes under Sadvrita. Once we follow all these things, you are really a human being to live in this earth and make others also to live. Then comes Vega. Apart from the earlier explained food habits, code of conduct, etc., most important etiological factors for the disease is suppression of natural urges. Na vegan dharete dhiman. Some of the activities which occurs naturally either to expel or to pacify or to satisfy which are often not induced are termed as vegas or natural urges. Ayurvedic masters have listed dharaniya vegas which to be controlled and adharaniya vegas which not to be controlled. The word Vega Dharana has two components, Vega plus Dharana we say. Vega means natural urges and Dharana is suppression. This Vega Dharana means suppression of the natural urges, initiation of Vegas or normal body activities through which unwanted body material are excreted. This is the process timely carried out by body at regular intervals and controlled by nervous system. Suppression of which is not only stops the elimination of waste products but also brings strain and disorders of nervous system causing many diseases. This develops into those who have regular habit of suppressing urges for long period and not immediately. So it is very important to respond to these urges and not to suppress them. Ayurveda explains that there are different natural urges exerted by human body and for well-being of the human body some urges are to be suppressed also. Grantakaras describes 13 adharaniya vegas, non-suppressible wages, which should never be suppressed. Vega na dharete vata vinmutra shavatu trut shudham nidra kasa shamashvasaha jrumbha ashru chaddi retasam. Ashtanga Hridaya Sutrasthana, it has been given. The above verses states that the following urges should not be suppressed. So we'll come to know the each Vega name and what it causes. Once we come to know about all this, really we have to attend to the nature cause easily. Vata Vega, that is urge of passing flatus upon a vayu. Abdominal tumor it causes if it is controlled. Udavarta, painful upward movement of vayu starts passing upwards, which has to go downward upon a vayu. That also tumors, debility it causes, obstruction of or to pass flatus, urine and feces, diminished loss of vision also he says because it has gone upwards. It has to go down. So heart disease also it causes. This has to be given a more importance here. Purisha Vega, urges of feces. If it is controlled, cramps in the calf muscles we can feel, headache, cutting pain in the rectum, fissure in it is known as medically, upward movement of the vayu in the abdomen, fecal vomiting, oppression in the heart region, pressure in the heart, as though we cannot sit or sleep or do any movements we feel. We feel very uneasy at that place. Mutra Vega, urge of urine also if it is controlled, urinary calculi because urine concentration happens in the bladder, cutting pain all over the body, specifically at the urinary bladder, penis and groin we see. Kshavatu, even a sneezing if it is controlled. But definitely we have to cover our mouth. The spit shouldn't be thrown out on the front person or anywhere. Headache we get it. Debility of sense organs because some particle has been obstructed there. That is a reason our body shows us a sneeze to clear it out. Neck stiffness and facial paralysis up to that it goes if it is done on a longer durations. Trishna Vega, urge to thirst. If I don't drink water when I am feeling thirsty, you feel emaciation, weakness, generalized debility totally, deafening because jala up is very much necessary for the circulation for our system to happen. Delusions, we start feeling the imaginary things, giddiness, and heart diseases. Anything vayu is concerned which goes upwards, it causes most of the things. Heart disease means don't think it's a cardiomyopathy or something like that. Some heart conditions we see. Shuddha Vega, urge to hunger, splitting pain over the body, aversion towards the food. Later, if you're too hungry, you can't eat any food, we say. I was very hungry, I'm not able to eat now. Exhaustion, if you feel too tired. emaciation, you become weak, pain in the abdomen, it happens, and giddiness also we can check into it because there is no energy there, no flow of rasa dhatu has happened. Rasa exactly strengthens your system. That is not there at all. If this happens, definitely you feel very weak and discomfort and tired, where you can't eat any food at that time. Vomiting sensation happens means you don't like the food. Aversion food starts happening. Then mind plays a bigger role there. It says don't eat anything like. Because of this habit, the same food if you are showing them in a regular basis, you get averted. That is what we do for our children. We just push the food into the child's mouth because we don't have time for ourselves. We think we are very busy feeding our own children, we do this. So the child starts avoiding the regular foods. It starts saying, no, I don't want. That is our own problem, what we have created presently for our children. Nidra Vega, urge to sleep. If you are stopping the sleep, delusions he gets, heaviness of the head, eyes, laziness, yawning will be there, pain all over the body you can see. Kasavega, coughing. If something as object has gone to the throat, to the instead of going into the food particle or something, going into the esophagus, it has gone to the trachea. It causes kas or a sneeze. Kasa increases the and further leads to dyspnea, difficulty in breathing, anorexia, no taste to the food, emaciation. Once taste is not there, whatever you eat, there is rasa formation is not completed. Hiccups you get, heart disease you get. Shrama Shwasa Vega, urge to breathe heavily on the exertion. That also, if it's controlled, the air has to gets blocked, the vayu gets blocked, kapha gets surrounded, gulma, abdominal tumor, heart disease, and delusion starts. Jrumbha Vega, urge of yawn means inhibiting vatas, gati. Vata gati itself you have changed. Headache, debility of the sense organs, neck stiffness, paralysis. Because I was supposed to yawn. When I close it out immediately, you can see the negative pressure building up so much in other organs. So the blocked air in the mouth spreads there and causes hits it. Ashruvega, urge to cry, running in the nose, which happens. Pain in the eyes because water through the eyes has been blocked. So it takes the other passage. Head and heart stiffening in the neck, anorexia, giddiness, and gulma. Chardivega, vomiting. Visarpa, he says, which was supposed to come out from the mouth, that has gone inwards. It is pitta also is joined and kapha also joined. So skin disease, herpes it starts, rashes, various skin diseases, irritation of the eye, itching, fever, anemia, cough, dyspnea, nausea, discolored patches on the faces, all can be seen. Shukravega, urge to discharge seminal fluid. Suppression of voiding semen results in increased flow because it was more already accumulated. Again, next force is there, which it will be more. Swelling and pain in the genitalis, fever, pain in the heart region, and all over the body, obstructions in micturition, enlargement of scrotum, and seminal calcular impotence. That is the reason these are the urges has to be past means it has to be past. Clear means clear. Sneeze means sneeze. Yawn means yawn. But see the circumstance where you are, behave in a proper way. The body language. Swadvrutta. These are dharniya vegas, which to be controlled, whatever condition you are in, whether you like it or not. You are in the society, you are in your own concern also. Lobha, it's a greed. Ishya, jealousy. Dvesha, enmity. Matsarya, revengeful. Raga, attachment. Kama, desire. Shoka, grief. Bhaya, fear. This all has to be controlled to be as a human in the society, in a family, in my own concern also, to have a healthier and good concerns. Then comes our Chikitsa Chatushpada. Here, 4 quadrants of successful treatment is scheduled. Rogi, Dravya, Upastha, Vaidya. So, these are the 4 people has to be taken care completely. You should know what is what, how is how. Then only we can definitely understand what to do. Chikitsa. Chikitsa Chatushpada. This is a very, very important aspects where we have to follow. First comes Swastasya Rakshanam. Aturasya Roganat. Both are well managed. Primary goal of Ayurveda is to maintain health and relieves the suffering. Swastasya Rakshanam. Aturasya Roganatu. Both are well managed in the presence of required support. Ayurveda has ample emphasis on every factor concerned there. For a successful management, 4 limbs are there. Rogi, client, Dravya, medicament, Upastha, therapist or attendant, and the Vaidya is a physician. In each part, they have given further 4 divisions. Rogi, as a client, what we say. Now we have become more polished, not telling them as a patient. The one who needs the care and management is the patient or the client. First and foremost quality in the client is he should be adhya. Economically, he should be able to afford the expenditure. That is basic or simple thing. Or to come to the place, to the doctor, to the Vaidya, he should have some money. And whatever the advice we say, he should be ready to follow for that. Bishak Vashya should have a faith and obedience in the physician and should be ready to follow the instructions properly. He should believe in the doctor, otherwise the medicine doesn't work because he won't have a faith. He may take or he may not take it. That time even Amrit becomes wish, we say. Obedience. He should listen to the doctor, the physician, and follow all the instructions given. If the medicine has to be given for digestion purpose, after the food, if he is advised, and if he takes before itself, it doesn't work. Or digestive medicine, whatever we want to give, if he takes more first itself before eating something, the food, there is no food to digest where the medication should work. So he should follow the instructions, whatever the doctor says. Janapakaha, have a good memory so that he can explain his suffering more effectively and also to remember the instructions given to him. Otherwise, he doesn't know what has happened to him. How it started. When we start asking questions, Prashna. Prashna is the one. We get a correct picture of a person, or the condition, or the disease, what he is suffering into. So he should have a good memory to that also, and whatever the doctor says to follow also. Sattvan, having strong willpower to get cured and relieved. This is very, very important because he himself doubts. That time no one can help him. He can't guide him, which doesn't going to work there. He should believe himself. He should have a strong willpower. Yes, I have come here. I should be better or I will be cured. Usually cured word we don't use in some of the main cases, like we can be better, we say. Or I'm to make him healthy. A sattvavan he should be. Then comes our dravya, the medicament. The substance used to pacify, relieve or cure or identify as suffering is termed as dravya. The qualities of dravyas again he has given 4 here. Bahukalpam. The single drug can be used in a multiple forms and modes. Otherwise, it's very difficult for us to give in a medical form, as a medicine form. If it is a small children, we have to make it in a drop wise. If it is a little mid-age person, he can consume it in a capsule form or a tablet form or whatever it is. Even churna form. Whatever the form you want to do it, it can be given. You should be in the condition to make it in Bahu Kalpam, different modes or forms. Bahugunam, having many pharmacological qualities it should be. A single drug having a single quality doesn't help us. At that case, for fever I had to give one, for headache one I had to give, for cold I had to give one, cough I had to give. Patient doesn't have time to have his normal food. He'll be only busy with his medicaments, which is not advised again. So it has to have Bahugunam, Sampannama, being procured from a clean place and with a good potency. Sampanna. I can't take some medicinal plants from where the sewage is passing. They are not good. The quality of the medicament is not good at all. So wherever I procure the drug, it should be from the clean place with a good potency. For a plant, of a tulsi plant, if we take an example, I have not put good water, good nourishment I have given. And what quality the tulsi plant can give me? First of all, the plant itself is a very weak. The quality of the plant also is a weak. How can I expect the results from the patient? So, Sampannama, Yogya, suitable to the client and appropriate to the suffering. But a few dravyas may not be good to the client. It may be a good plant. Or if the quality or the divisions of the plant may be not suitable to the person whom I am giving. So it should be suitable to the client and appropriate to the sufferer also. That type of medicine should be Yogya, we call. Then comes Upasthata, the attendant. Example, you can take as a nurse also. The attendant, any individual who either assists the Vaidya, is carrying out the procedures, who takes care of the patient, carries out the instruction of the Vaidya, is called Upasthata. Who assists Vaidya, who takes care of the patient also and carries the instructions of Vaidya also, is Upasthata. In the present status, all those like nurses, attenders, therapists, masseurs are included in this category, we can see. Attenders means even attendant of a rogi also. Where we would have guided him, we would trained him or something, he is going to follow also. Upastha. These individuals are not doctors, but by the designation, they need to know more about the disease or diseased. Response shown and most importantly, handling the patient directly. The four qualities of these personnel should possess are Upacharnata, knowledgeable and skillful he should be, and caring he should be. Whatever the doctor says, he should understand. He should be skillful. He should know how to act it, how to use it, how to work on it. He should be so skillful. Dakshata, efficient and dexterity. He should be efficient. He should be also knowledgeable. He also should be educated one or guided one. Anuraga, compassion towards a client. This is very important. He can't be rough and hard or rash to the person who is already suffering. He should show compassion. He should be loving, caring towards the client. Suchi, he should be clean. If he himself is not clean and if he is only having a lot of infections, he'll carry it to the patient. Patient, first of all, his general condition is not good. He is first of all weak. So he can catch more infections. So that also should be taken care. He should be suchi. He should be clean. Then the patient can be responding very well. Then comes the Vaidya, the physician. Though all the above three limbs are present, the absence of physician results in failure of Chikitsa. Because he is the one who examines the client, decides the management, selects the drug, and finally instructs the assistants and the attendants. Hence, Vaidya is Pradhanata is accepted. Even he also has four qualities to be followed. He also should be daksha, efficient. He should be alert, updated with dexterity. If I have a old medical knowledge, it doesn't stand anywhere to me. Updated knowledge. That's the reason for our doctors we have a continuous medical education program. What is happening in the world? What is the procedures? What is seen there? Who is doing what? He should be updated. He should be efficient. And he should be alert immediately. If there is some action or reaction, what next has to be taken care. He should be daksha, efficient. Shruti Parya Vadattatvam. Excellent knowledge of the science he should have. Without knowing the knowledge of the science, we can't know anything or we can't treat anyone. Bahusho Drushtkarmata, having sound practical exposure to the treatment modalities. Otherwise, just a glance of something, doing something, instead of helping a patient, we are causing a lot of problem to the patient. That doesn't work here for us. You should know what to be done, when to be done, why to be done, duration to be done. Even he should be suchi, he, clean. Vaidya also. Maybe so. He's a doctor. It doesn't mean he should be dirty. Whatever this is, not the expenses, so materials or something which is going to keep him clean or purity. Whatever he wears, whatever he uses, he should be clean, neat. Then the quality of a doctor also can be followed or checked into. Because of his good knowledge, he can treat a people, he can work on the purposes. So this Chikitsa Chatushpada plays a major role in our Ayurveda. This detail aspects I mean, it's very difficult to find other sciences